Hello everyone, I'm Brian Work. I'm a general internal medicine doctor, a hospitalist at University of Pennsylvania. I'm one of the doctors who staff Streetside Health Project at Prevention Point, Philadelphia. I have worked there for a number of years now, actually since its inception back in the early 2000s. I started as a medical resident that I really loved. For me, during my residency, this was a break for me. One gets very tired and emotionally stretched during times such as medical school or residency. And for me, my time at Prevention Point was a time to recharge my batteries, a time when I could go and give of myself outside of the context of my medical residency, help other people. And I found that this really then charged me up for the rest of the week. Going into work the next day, and still this is the case for me now as an attending physician, going into the work the day after working at Prevention Point, I feel as if I have a renewed sense of why I do medicine. And this is something that I have seen, and I've heard students and residents comment about a lot. Now, not just with Prevention Point and Streetside Health Project to be true, anytime one goes and helps those less fortunate or helps marginalized people who really need assistance, I think it really adds something to yourself and enables you to kind of better emotionally deal with all those things that you must deal with in your regular course of life. I often have medical students say to me that this is the high point. This Streetside Health Project, work at Prevention Point, is the high point of their week, and it really buoys their spirits for the remainder of the week. And it's for that reason that I really try to bring this message to as many folks early in training, any kind of health professionals, early in training, so that this sort of work becomes a part of their life. I feel very strongly about this. Next, I want to talk about, so we provide a whole panoply of services at Prevention Point. We provide Hep C services, or Hep C and HIV screening, HIV services, and a whole host of social and community services. One of the more important things we do, Streetside Health Project, is our clinic at Prevention Point. And one of the more important things we do there is we are able to sign people up to get health coverage. We do this through the state and get people on the state Medicaid rolls. But it's really just getting people health coverage. Because if you are marginalized and have chronic conditions or acute on chronic conditions, you can't deal with those without some health coverage to deal with chronic issues. What kind of issues are we talking about? We're talking about the very often encountered issues of hypertension, diabetes, seizure disorder, depression, anxiety, heart disease. Any of these things need more services and more intensive health care than we can give at our Streetside Health Clinic. We're not full primary care, although we are continually adding services. So we need to get people health coverage. So how do we do this? I'm here to talk to you today simply about the form we use to sign people up for health coverage in the state of Pennsylvania under Medicaid. Now, this form, called the Employability Assessment Form, which I'm going to show you in a minute, has a lot of stigma attached to it. Just as our patients carry a lot of stigma, this form for doctors has carried a lot of stigma. Why is this? Well, although it is simply the form to access health coverage and food stamps, two things that I think any health professional would agree are important to a person's health, they have entitled the form Employability Assessment Form. This does not, and it's put out by the State Department of Public Welfare. However, this form does not entitle you to payments, welfare payments. As I said, this gets a person health coverage, and it gets them the ability to get food and via food stamps. So, what does this form look like? As I mentioned here, it is entitled the Employability Assessment Form. So why is it called this? It is called that because the state knows that any doctor, if asked to sign a patient up for medical coverage, will sign that form. The state knows that doctors are less likely to sign a form that speaks about disability or employment, the ability to employ or to work. So, on the first page of this form, there is a section where the patient is supposed to state in their own words why they feel they cannot work, or why they feel I often phrase it as why they feel they need healthcare coverage. If they have chronic conditions that interfere with their life on a daily basis, such as severe asthma, such as seizures, epilepsy, or seizure disorder, that interferes with a person's daily life. Diabetes, if a person is constantly hospitalized for diabetes, that interferes with your daily life and your ability to work. So I try to have the patient just fill out in their own words what the way in which their medical condition interferes with their life. The second page is the portion that we fill out. Now, this page has several categories. The categories are permanently disabled, temporarily disabled for a year or more, temporarily disabled for less than a year, and employable. And then down below, simply a section for what the diagnoses are that in fact interfere with the patient's life. I like to think of it as conditions that interfere with the patient's life, not conditions that make a person unemployable. For indeed, one can work and still receive partial benefits, or work part of the time and receive these benefits. Now, it's occasionally the case. So what are some of the conditions? I sort of mentioned some of those already. They're the kinds of conditions that we see in regular medical outpatient settings, or with hospitalized patients, that many of our patients indeed come in with. And those conditions are those such as hypertension, high blood pressure, diabetes, asthma, seizure disorder, hypothyroidism, severe hypothyroidism, and then other disorders, mental health issues such as depression, severe and disabling depression, or intermittent depression, severe anxiety, and PTSD. Many of our folks who live on the street or have lived on the street and are marginalized have dealt with a lot of these issues, and often without adequate care. So what we want to do is get them care by signing this form. Again, I will say that although this is entitled the Employability Assessment Form, this really has nothing to do with a patient's ability to work. This is the form that we often say is the form to get people health coverage, or the form on why I should be granted health insurance. Under those terms, I think it's something that doctors readily agree, and any other health professional would readily agree is really necessary for a patient to live their life in a healthy fashion. Now, many doctors fear that signing this form, because of what it is entitled, the Employability Assessment Form, that in some way the Department of Welfare is going to track them down, find out why they signed the form, if indeed the patient is employable. That does not happen. This is a form for health coverage. It gets filled out. I have been doing these forms for well over 10 years. I've probably filled out thousands, and I have never been asked why I filled out one of these forms, although I have gotten many people coverage who otherwise would not have had it. Additionally, about the only thing I am ever asked for is that I didn't fill out the form completely, that I didn't put my MD license number. That's the kind of that's the only level of scrutiny that this form seems to garner. So I will tell you that in many clinics, many doctors will avoid filling out this form, or feel just very hesitant to fill out the form. But I think once one realizes this is simply to get health coverage, it becomes understandable as one of the most important things that a doctor can do in their daily course, in the daily course of their work or their volunteer work. Because when you are in a hospital and you're providing care, that patient already has access to care. We are simply fighting for patients in the first place to have access for care. Again, Prevention Point and Streetside Health Project are a venue that I have really found fulfills me and makes my life more worthwhile, meaningful, and balanced on the whole. And I think that the medical students, the nursing students, the social workers, the social work students, the undergrads, and the grads who come into this clinic universally find the same thing. Wow, this is really something that makes me feel good about myself and makes me feel good about helping others. I hope to see you all soon at Prevention Point and at Streetside Health Project, where I think we can do a lot of good work for people together. Thank you very much. One more important fact about the employability assessment form, or the medical coverage form, is that oftentimes people will come into our clinic with emergent or emerging conditions, urgent or emergent conditions. A good example of this would be a person who has a seizure disorder, has previously been on seizure medications, and has run out of them from their last hospital stay. There's an urgency in that, and there is a form with which we can deal with that. There's something called a life-sustaining medications form that we can fill out in addition to the employability assessment form. When we fill that out, we know that this condition is something that may significantly debilitate or even kill the patient. If a person goes into uncontrolled seizures, that could mean death. And and similarly with asthma, if someone has very bad asthma and continues to have asthma attacks without medication, this can lead to disability and death. Therefore, we fill out the life-sustaining medications form, and this gets people the medications more quickly, but also gets this employability assessment form processed more quickly. And both of those can be very important in many of the chronic but serious conditions that we see at Streetside Health Project.